Thanks for tuning in to Live Life Well with me, Nikki. I am very excited to introduce my next guest slash friend, Mandy Stokes. She's a social worker in private practice, working in the same field as me mostly. And we are very much in alignment with the way we think and the way that we do things, and it's kind of not your stock standard. So I'm really excited to be able to pick her brain. We're going to be talking a lot around family intervention in terms of dealing with someone who has a substance abuse problem, and hopefully we can answer some questions that you might be having. And if we don't, please feel free to send me a message and I'll try and answer it as best as I can too. Welcome, Mandy.
Thank you for having me here, Nikki.
When did we meet?
Sure. I think it was last year in 21.
I've certainly known about you and known of you for many, many years. And for me, you've always been the go-to when there's some family support necessary. I try and sidestep the family stuff as much as possible and deal directly with the addict himself. Just knowing how difficult that process often is for the family, and also knowing how like left alone in the process they often are. And I'd love to know like what focus you have on the family in the work that you do and how that all works.
So, I mean, in theory, you can, sort of come up with a lock, stock, and barrel kind of approach, but it doesn't necessarily work. It's like each individual, each family is unique. Quite often, the way that I come across the families is they'll convince the addict to come and see me. The addict's not really willing. Um, and then the family come and see me, and I prefer to work with the family to get them to a place where they can start setting boundaries and looking after themselves. Because in that process of actually setting boundaries for themselves, it makes it really difficult for the addicts to just carry on using.
Why do you think that like you find it like more effective to deal with the family? What's behind that?
Well, I mean, quite often what happens is the family, because parents want to be there for their children. They want to, don't want them to suffer, don't want them to get arrested. So what they do is they keep on protecting the consequences, and they don't want to be told that they're bad mothers or bad fathers. And addicts have this way of kind of getting underneath that, with parents. And it's really about being able to work with the parents that they can get to a place where they realize that they're falling into the manipulation.
So would it be fair to say that without realizing it, the family is often very much a part of the problem?
Definitely.
How does that go down when you actually try and explain that to a
Sure,
family?
sometimes you have to sort of go over it and over and use metaphors, and eventually you get to actually saying stuff like, every time you give him 50 Rand, you're helping him to kill himself. So I mean, I try to not be that crass around it, but it's about them realizing what they are doing. But they get so scared of this addict that becomes a monster when they're going through withdrawal that they don't know what to do. So what I've seen is like, I mean, I've done the sort of the committal orders and all of those kinds of things, and um, families struggle to follow through, so they'll come to me and they've tried everything else, they can't do this, whatever. I say, okay, well, this is the process that we need to follow. And then they get to, oh, no, I can't do that to my child.
What do you think that's about?
They're scared that the child is going to hold it against them for the rest of their lives because the child has been saying to them, you're a bad mother, give me money, you're a bad mother, give me money. So it's just like they've always kind of been brainwashed into that, thinking that if I do this, I'm going to lose my child.
I think that, one of the struggles that I have is that I'm known to be pretty direct when I'm giving feedback to anyone. And one of the parts of feedback that I need to give people is like twofold. One, the belief that no one died from too much love. Not true. You can actually suffocate someone to death with too much love. And the other thing is also just saying, like, are you more concerned about whether your loved one still likes you, or are you more concerned about saving their life? To be able to say to a family member, loved one, that are you more worried about this person still liking you or loving you, or are you actually concerned about saving their life? Because that's really where the difference is going to lie.
Sure.
And I think it's quite a painful thing for families to have to swallow.
Mm-hmm.
Say, well, I'm more interested in whether this person's still going to like me at the end of it all. Not an easy thing to accept or acknowledge as the truth.
And I mean, it is really difficult. I just have this kind of image of, if a doctor comes and your child is unconscious and they need to have a leg amputated, and the parents need to give the go ahead, amputate the leg because they need to, in order for them to be able to live, otherwise they're going to die from septicemia. That's still a difficult decision to make. So I mean, it's like parents need a lot of empathy, so you kind of need to say that to them, and they need to get to understanding. But it takes sometimes a long time before they actually get to that place. And what I found, that even the parents that come to me that want to have committal orders done, and they go backwards, forwards, and it's about kind of acknowledging what they've done and kind of helping to point out the discrepancies and all of that. And eventually they do get to a place of being able to say to their child, you know, I'm not going to give you any money. It takes longer than doing the committal order, but it's less stressful for the family, and it's less stressful for the addict as well.
That takes a lot of patience. And
Yeah.
in the same breath, though, I can certainly see with my own son, who isn't an addict, but just who's my baby, and there's often times where I'm wanting him to love me, and so I don't want to put in that like discipline or that boundary. And I can see the knock-on effect from that. So as much as I'm like harsh and direct, I suppose, with families of an addict, maybe it's because I know that it could potentially mean a death sentence for their loved one, that it's so urgent, that type of intervention of putting in the boundaries and saying, like, I'm not going to enable the behavior anymore. Tell me why the field of addiction for you.
Well, I I don't know.
That's often my answer too. I think what I'm asking is like, what's the personal story behind this? Because addiction, like, this is a calling. This is not for everybody.
Yeah, and I think I mean the calling obviously started because I was using drugs, and I started using when I was 14. Cleaned up when I was 28. Was very, I don't know, confused and curious that I managed to get 1 year clean when a lot of the people that were in rehab with me didn't get clean. And from that curiosity, it kind of led me to go and do a counseling course, and then I was offered a job in the counseling field. Um, and then from there, I went and I did a social work degree, so it was like a kind of process to get to where I am now. And actually, when I did the social work degree, I wanted to get out of the field of addictions. But wherever I go, it actually follows me,
Once it's got you,
Yeah.
that's it. You're not
Yeah.
going anywhere. Sure.
Yeah, and it does. It's like, I mean, it would, and I suppose it's my way of kind of giving back, So I do a whole lot of other things as well. But there's, especially for people that are sort of like on that verge of should I go into treatment or not, if they speak to me and they know that I've gone through treatment as well, it becomes just a lot more realistic for them, and not as scary to be able to go through.
Yeah, I mean, I think that as much as I really push the idea that, anyone who is an expert in the field has got as much knowledge and expertise to deal with someone who's struggling with addiction, the reality of someone who's actually lived through it, like you or like me, I think it does definitely hold some pull, some clout when you are speaking to a family member or the addict themselves, just to know it's okay.
Yeah.
You can go down this road and that there is a light at the end of this tunnel.
Yeah.
Not just from a book.
Yes, not just from a book. And I mean, the thing about the families, that sometimes sort of those sort of the self-disclosure that comes with, this is how, I mean, because actually my parents didn't really ever set the boundaries. I was arrested. That's how I got into rehab. Um, I think that's the first time that they actually set a boundary. But to explain to them sort of the things that my parents did, that because they loved me and they didn't want to hurt me and they wanted to protect me, and how it was actually not really a solution, at that point in time, but it made them feel better. Sort of what you were saying earlier.
What did your parents do?
Sure. They gave me money. I felt like a lost little girl. I didn't want to work. Okay, I felt too anxious to work. My father created like a position for me that I actually didn't even have to leave my house. Okay, I got paid for it, and all I did with the money was use.
How long? You said from 14 to 28.
14 to 28, yeah.
I mean, I try and explain to people the difference between help versus enabling. And I think our loved ones are super confused when it comes to that, you know? Like, how do I tell the difference? How do you tell clients to tell the difference between help and enabling?
Sure. How do I tell them? If they can do it themselves, you need to allow them to do that. If it takes them 3 months to do it, still don't do it for them, you know, because they kind of have to learn how to take responsibility for themselves. Because if you don't, like when I got into recovery, I felt like a 14-year-old. I didn't know how to go for a job interview or anything like that.
Sure.
No.
It's quite hectic to kind of accept that our families played a role in our level of dysfunction. How is your relationship with your family now?
So, I mean, I'm still the only sober person in my family. They're sort of more functional in the way that they use substances. Um, it's only really been in the last sort of 5 years that I feel that they actually listen to what, like, you know, before that I was 22 years clean. It's a long time to be clean, but only in the last 5 years are they sort of looking at me and saying, oh, okay, maybe she knows what she's talking about, you know. But I was kind of seen as that little girl in the family dynamic. And quite often, uh, you know, like very unhealthy decisions get made in the family. And I suppose I didn't really say anything, you know, and sort of like since saying that, I mean, if I think kind of link it on the timeline, my mom passed away about 4 years ago. She was very sick the year before, um, you know, and things have actually started changing because my mother was actually my ally. She was the only other person that was sober in the family.
Sure, that's a tough one.
Yeah.
And I so relate, you know, I also have almost 14 years clean and I'm still the black sheep in the family, but now for a different reason, you know, whereas I'm the only sober one and everyone else is to various degrees kind of falling left, right, and center. And I'm still quite left out of that whole like family process, the family dynamic. It's quite it's bizarre, you know. Just now that I'm clean, I'm still left out. You know, there hasn't been that healing. Has there been healing for you through this recovery
I mean,
period?
definitely there's been healing, and sort of as you're talking about, um, you know, like sort of being the black sheep, and for people going back into their families, and the impact that families can have on someone's recovery. I mean, it's a hard journey. Like if I had relied on my parents to keep on setting boundaries with me, it wouldn't have worked. Okay, because a day out of treatment, my father offered me a whiskey kind of thing, you know, and couldn't understand why I didn't want to drink whiskey with him anymore. Um, so it can sometimes be very lonely in a family. Like you can't tell a family not to drink, but it's almost like they don't have an awareness of how it affects people in early recovery. You know, it's not really affecting me now anymore, although I mean, if they're all drunk, it does. But for someone that's just coming, you know, sort of out of a treatment setting, it can be daunting when people around them are not really sensitive to what they need to deal with.
100%. I mean, I find that I actually just don't get invited to things, which is equally hurtful a lot of the time. And I found working with families maybe a bit cathartic for me in the sense that I couldn't find that reconnection or healing in my own family. That when I could facilitate or support families and their loved ones reconnecting in their own healing process, and I suppose even allowing myself to feel sad for the families that were going through this, because I didn't feel sad about my family, I felt angry. And so it allowed me to heal through working with family members. But it's quite a difficult process because families need a lot of education. And like you said, it takes a long time. Earlier, you mentioned a committal order, and you and I both being in the field know exactly what that is. Like, how would you explain that to someone who's just coming to you for the first time and their loved one is completely unwilling and disinterested in getting any sort of help?
So I'm, what I normally do is I actually tell them about all the options. So the first option would be that we maybe try and do an intervention, and from there, when you do an intervention, you kind of get all the information from the family, and you try to get as many family members as possible together, that they can all speak with a united voice around their concern and to do this sort of intervention from a place of love. Once I already have all of that information, if that intervention doesn't work, we normally have the information that we need to go and do a committal order. Committal order goes in terms of Section 33 of the Prevention and Treatment of Substance Abuse Act. Um, you get an affidavit from the family, you've got a social work report, which has got all the evidence of why the person is in need of treatment. The affidavit also says that the person is a danger to themselves, to others, the community, etc. And parents need to sign that, and that's they get scared when they have to do that.
So this goes through the court, right?
Goes through the court. All of that documentation gets taken to the prosecutor, and then they set up a court date where the social worker and the addict needs to appear. So the other place where families get really scared is they say, but how am I going to get my child to come to court? So when I go to the prosecutor and I know that the person is going to refuse to come, what they do is issue a warrant of arrest, and they will then go and fetch the person from wherever they are. The day, like in the morning of the actual court proceedings.
And if they can't find the loved one,
then it gets postponed. And you know what? Because they can't find the loved one, okay? Now the legal system, because now it's contempt of court because the person did not appear in court.
So it makes it more complicated.
Yeah.
Okay. And is there a criminal record at the end of a committal order? How does it actually work?
No, there's no. A committal order is issued for a year. And you also need to have a treatment center, a registered treatment center set up as where you refer the client to. The center manager is the person that then takes ownership. If that program's only 3 months, there needs to be something in place that actually monitors that client, and that if they relapse, they can go back into treatment.
So it's no like criminal record. It's simply being forced to go into rehab without a choice, I suppose.
Without a choice, like you take a person's rights away. So I mean, speaking from the social work perspective, like that's serious business.
That sounds
so it's not something that I would just do, unless someone's life is really in danger. And I've exhausted all other avenues of trying to get that person into treatment.
It sounds really scary, but I mean, on the other side, a lot of people will say someone has to go into treatment willingly. If they don't choose to go into rehab, it's not going to work. Like, how do you respond to that?
I don't think that's true at all, because people can come into treatment, they may come in kicking and screaming, okay, against their will, but creating that sort of space where they're off the drugs, they're detoxing, they're able to start thinking clearer, and recovery can start happening. Whereas someone can come into treatment willingly and have that same sort of, safe space, but start getting uncomfortable and the defense mechanisms start coming up, or they get involved in a relationship in the treatment center and then recovery goes out the window, kind of thing. So,
I try and explain to families, it's like your loved one is possessed in a way.
yeah.
And you're asking this person who's possessed to make a decision that's going to benefit their life in some way. And their rational mind is just not capable of doing that in that moment. And sometimes, as the family member, you have to take responsibility for making a decision that's going to change the course of this person's life. And I mean, just listening to the way that you explain a committal order, and I mean, I recommend it quite regularly. It sounds really scary, and maybe like more compassion even from my side when I am describing it or explaining it to families to have this hectic type of intervention. That it's quite an ordeal.
Yeah.
And as much as I want to say that your loved one will love you at the end of this because they're going to be more in their right mind, how is this person going to believe that?
Yeah. And it's a risk that they take. So you have to weigh up the risks, okay? So if someone is binging, but not getting to a place of, like total destruction, you know, like let's try other interventions first. If someone's on the street and their arms have gone septic, I say yes, that's what we're going to do, because at that point neither one of those people can really make a decision, you know, because of the amount of substances they have in them. But you want to maybe try, not take the harshest route right from the beginning.
Yeah, I hear that, you know, I think about my journey, and although there was no committal order in place, my mother was pretty hardcore and you know, forced me in her way into treatment. And earlier you and I were chatting off camera, and you were just saying that like no one really goes into treatment willingly. Like, what does that mean?
Well, I think everyone is really scared to come off their drug of choice. So the thought of like sort of being in treatment and having to make changes is really scary. But you also don't really have much of a choice, okay? Because, you know, maybe you've got written warnings against you, your wife is divorcing you, um, don't have work, don't have a place to stay. But if we could use without the consequences, I think we'd all just carry on using.
Absolutely, every
Yeah.
addict's dream.
Yeah.
You know, there's I think a misconception or like a wrong understanding that when you go into rehab and you get better, that you're going to hate the drugs and not. I mean, it's just not how it works. If the drugs didn't make you feel amazing, you wouldn't have done them in the first place. And it's getting to that point, I suppose, of the consequences just aren't actually worth it anymore. So, how much joy do you get about working from with someone who's either the family or the loved one who needs help? Is it your passion? How much are you kind of like filled by doing this kind of work?
So definitely working with addiction, with the families and the addicts can be very rewarding. It can also be emotionally exhausting. So when I started off, I did a lot of work in treatment settings. Eventually, I got to doing just some contract work in treatment settings because it was, you know, it's intense working with that stuff. Definitely, I prefer working on an outpatient basis now with clients and with their families. And, you know, you kind of have to balance your life around that. And it's really like the same way I've felt, you know, trying to balance my life and to make sure that I'm healthy. That's how families need to look after themselves as well. It's like all fine and well. Yes, you've got the addict living in your house and there's all of this crazy stuff going on, but you also have to look after yourself. And you need to create distance. Yeah.
I so relate to that. You know, like as much as this isn't a 9 to 5 job, and addiction certainly doesn't keep office hours. I've had times where it's been all consuming and my life doesn't actually exist. It's like I'm sucked into everyone else's needs and their story. And I think, you know, you mentioned about how you wanted to get out of the field of addiction, and I relate. You know, I tried to kind of sidestep and move away, and you know, it just kind of brought me back in. But really what I needed was to be able to set boundaries and say, like, I don't need to be caught in someone else's chaos.
Yes.
Like, this is my life and my space, and this is what I'm prepared to offer you, without it encroaching on me. So I mean, like, I'm listening to you and just reminded of that time. And now it's far more like I love it. And I went through a stage where I really didn't. I don't know if you relate to
No,
that.
definitely. And you know, the way that you've explained it now as well, it's I mean, explaining it like that to a family member, you know, is that it's to not get caught up in the chaos of the addict and to actually have those boundaries. You know, because otherwise, you know, families go crazy, and I thought I was going to go crazy, you know, because it is like you don't have a life.
For sure. And I don't know about you, but I would get calls saying, now they're doing this, and what should I do here? And now they're doing that, and feeling almost responsible for other people's lives. I don't know if you relate to that.
Yes.
Like, you know, it's so much pressure and it's exhausting. And I think for me, the personal work was to get to a space of saying, like, this is the info that I can give you, but the work is yours to do. It's not mine. And I'm not responsible for the outcome. And nothing comes with a guarantee, unfortunately. I mean, I suppose that's one of the hardest things to kind of explain to to families that are going through this process? I don't know what type of responses you get from families when you say that to them.
Definitely, you know, like because families want people to be fixed, and you just say it's like, oh, well, these are the options that we have, you know, but we're not sure which one is going to work. As such, you have to try what works with that individual. And again, I mean, you know that there's no guarantee in recovery. Um, you know, we have to work at it every single day. And it's the same thing with families. They're going to set a boundary one day and then the next day go against it because that's not going to be a sustainable thing.
Yeah. And I think like one of the questions that I like often get is, the family saying to me, but like if I set this boundary with them, I told them that if they don't stick to it, then I'm gonna kick them out of the house or I'm gonna divorce and I'm like, do you mean that? Because if you don't, your loved one knows that you don't, and as much as addiction brings a level of dishonesty for the addict, it brings a level of dishonesty for the family as well. It's like telling your child, if you do that again, I'm going to smack you, and you never do it. Then when you say that, the child's going to be like, well, no, you're not. So I can continue to do what I like. And I suppose that puts that responsibility back onto the family all over again.
I mean, it just reminds me of a case, 15-year-old that I'm seeing that's disrespectful, verbally abusive with the family and then at school. And eventually it gets to like I'm working with the family and the child. And then eventually the child says, like what does he do? What he does, because he can get away with it. Parents don't set boundaries with them. So he'll continue to be verbally abusive until they set boundaries. And he even came up with his own consequences.
My children are pretty wise.
Yes. Yeah.
Yeah. So I mean, like, out of the sum total of all the work that you do, how much of it is taken up by family intervention stuff?
I would say about 25% is addiction and family orientated.
What about the rest?
The rest, I enjoy doing group therapy kind of thing at psychiatric clinics, like mental health focus and doing employee wellness. I'm also an educator at a university. Yeah, so we've got
I
a lot
love
of different
hearing
things.
that. I love hearing that because it just reminds me, and the message that we want to give to our patients and our clients and their families is like, doesn't matter how the story started.
Yeah.
Like the storyline can change at any point, and like myself,
Yeah.
how I thought my story was going to end at one stage was not very pretty, versus to like sitting here now with you and having this conversation.
Yeah.
It's like, how did that happen? How did we get here? And if nothing else, I'm hoping that from this like discussion between the two of us, if we can instill hope in like the people that we work with or who know us or cross our paths, then I think that we've done a really good job.
Yes.
Thank you so much for being here. Listen, I love working with you and I look forward to many more discussions like this and helping many, many more people.